Spaulding Rehabilitation Hospital is recognized as one of the top rehabilitation hospitals in the country, achieving a rank of number 2 in the 2018 U.S. News & World Report America's Best Hospitals issue. Its 4 inpatient facilities and 25 outpatient centers around New England are also an industry leader in treating sports injury and improving athlete conditioning. Using the latest in advanced research and innovative technology, Spaulding works with athletes at all levels to promote full recovery as well as improve performance. On this episode of the Celebrity Spotlight series, we'll meet the people at Spaulding, many of them accomplished athletes themselves, who are making a difference in helping others to reach their full potential. Dr. Adam 1040 is one of those athletes. A former All-American long-distance runner at Stanford, Adam now heads up the Spaulding National Running Center located on the campus of Spaulding Hospital in Cambridge.
I was part of a team that won 3 national championships during my time. Unfortunately, it was not all smooth sailing. The first few years ran into issues with injury and overtraining, and so it took a while for me to regain the confidence to be a successful runner. And fortunately, I was able to navigate that process. I ultimately decided to go to medical school and was very fortunate to have those previous experiences through dealing with injuries to inform my medical practice.
Adam's running injuries affected his life in another way. While rehabilitating, he met his wife, a former Olympian and one of the greatest runners to ever attend Yale University.
Her maiden name is Kate O'Neill. She was a very successful runner, finished 3rd at the Olympic trials and qualified for the Olympic team in 2004 in Athens in the 10,000 meters. She also was very successful in the marathon, finishing 3rd in her debut marathon at Chicago.
Both Adam and Kate are now part of the running community in the Boston area.
My current practice is focused on running injuries in athletes, particularly long-distance runners, to get people back out into the sport faster, and also a goal to prevent these injuries.
Recently, Adam has been working with another All-American from Yale. James Randon just recently finished his 4 years in New Haven, establishing several records, including becoming the first Bulldog to run the mile in under 4 minutes.
Everyone who tangibly runs a mile at some point in their life, they understand what it means to want to break 4 minutes. I've kind of bounced around. I've run distances shorter than that. I've run 5Ks and 10Ks, so distances longer than that. But the mile is definitely a distance that I have specialized in.
Randon is now running professionally for Saucony, but some lingering injuries have brought him to the Spaulding National Running Center.
I got stress fractures in 3 different spots in my pelvis. And it's not even to say that it was particularly painful, because I think I'd done such a good job of kind of keeping everything just fine enough where I felt comfortable in runs, but then I'd have all these different aches and pains, and I had to get a number of MRIs. I actually thought I had a stress fracture in my femoral neck, which is on the outside of your hip, but it ended up being a way deeper problem.
One of the common issues that I'll run into in terms of misperceptions on running injuries is that it's all about volume. So they'll assume they did something wrong with their training, or maybe they picked out the wrong pair of shoes. While those factors can be important, I think there are oftentimes other factors about nutrition, about strength and flexibility, and other parameters that are sometimes missed by the athlete.
They did a really good job of kind of sitting me down and figuring out why this one issue might happen. And there was a certain time period where I was supposed to wait to recover, and waited it out, and I did everything I was supposed to do initially, but it just wasn't quite healing, and it really required both Lindsay and Dr. 1040 working with each other and working with me to really kind of build up what's going to be the correct thing to push forward.
We have a lot of unique services here at Spaulding Cambridge. For example, we have an anti-gravity treadmill that allows us to adjust body weight. We also have access to ultrasound to look for the injury a little bit more dynamically than an MRI or an X-ray might. With the elite athlete, I can speak firsthand to the challenges of being injured while you're a sponsored athlete. You always wanted to have seen the doctor yesterday, to have had the diagnostic imaging a week ago, and to be running pain-free a month ago. And so the reality is I want to get that athlete back out there as quickly as possible, because I realize that their livelihood and their athletic career is so precious. It can be shortened by injury, and I don't want individuals to have those types of barriers getting in the way of being successful and enjoying the sport.
Obviously, it's been a long road back for me, but I'm definitely feeling very healthy. And Dr. 1040, having both the experience of being a very successful runner in his own right and gone through the injury process, it's been invaluable. I mean, I had the utmost trust in him, and he's it's got me back this far, and it's really exciting.
When we come back, the Celebrity Spotlight Series will look at the world of adaptive sports and meet a Boston Marathon champion who's also a pioneer in physical medicine and rehabilitation. With the worldwide boom in adaptive sports comes the need for greater knowledge in adaptive sports medicine. At Spaulding Rehabilitation Hospital, that knowledge is used to work with individuals with disabilities in not only conditioning, but making changes to a better way of life.
People often see things like adaptive sports as something that's nice to do or as sort of this elective thing, whereas we see it as really a core part of people's life experience and something that we have to do or that we have to provide opportunities for.
Going beyond and pushing boundaries is something that Dr. Sherry Blowett has been doing her entire life.
I experienced a spinal cord injury when I was quite young, and I've lived most of my life adapting to it and having the identity of being a person with a disability.
But it wasn't until high school that she began to see herself as an athlete. It led to a career that saw Sherry compete at the highest level in adaptive sports.
When I was a sophomore in college was the first year where I was sort of in that competitive mindset, and we also had an upcoming Paralympic Games. And was able to go over to Sydney, Australia. This was the year 2000, and competed as sort of one of the younger members of the team.
She went on to 2 more Olympic Games while at the same time becoming a force in marathon racing, winning the Boston and New York marathons twice, and the Los Angeles Marathon an amazing 4 times. Sherry eventually retired from road racing to focus on her medical practice. She now specializes in physical medicine and rehabilitation here at Spaulding.
I think being a doctor with a disability is a very positive thing. You know, when you're working with patients who are facing different experiences, I think there's a sense of comfort in knowing that your doctor also kind of gets it in terms of having times in life when you may have had to kind of get back up on your feet.
Like Sherry, Owen Anketel has dealt with disability his whole life.
My condition is known as hereditary spastic paraplegia. The muscles in my legs aren't strong enough to be able to allow me to walk, so I'm able to use low-strength crutches, and I can stand with nothing to hold on, but I can't make a step.
But not being able to walk hasn't stopped Owen from taking on several sports.
One of the sports that he really picked up and latched onto was the sport of hand cycling. And as he moved through high school, I think Owen began to become more involved and began to see that we need to do more in terms of raising awareness for adaptive sport.
I founded a nonprofit, Adaptive Sports Awareness, in 2015, and we're just trying to think of a big event that I could do. So we thought of hand cycling the East Coast. It took 2 years to raise all the money and to get myself prepared to go.
We were able to look at the symptoms that he was experiencing at that time, but then really understand that that was just one symptom of the bigger picture. And that's often the case in athletes with disabilities, particularly those who use equipment, like hand cyclists, wheelchair racers, where the shoulder pain or the back pain or the knee pain is probably just a symptom of poor biomechanics and needing to have a better fit and a better setup.
59 days away from home, it was a lot, but I made it work. So I had 50 people meet me down in Key West when I rounded the corner to the southernmost point marker, and there was all these people cheering me on. It was awesome. There are some people that don't even know what they're capable of and what's out there for them, and I want to be the person that can open the doors to people and show them what we can do and not what we can't do.
Owen now attends the University of Arizona on a tennis scholarship, but he is still thinking about his next challenge.
Not making any promises, but I want to go ride across the country soon. That's my next goal.
Everyone wants to be at their best, whatever it is their goal is. And one thing that I really love doing is just chatting with patients regarding what their goal is, and then working with them to achieve that.
Josh Boissonneau's time rehabbing at Spaulding, as well as working with Sherry, has opened his eyes to a whole new world of athletic competition.
Life was very active, played a lot of sports, and then about 5 years ago I was diagnosed with a rare neurological disease called CIDP, and that kind of put all that to a halt.
It was very clear that Josh, although his function was changing, didn't want to lose his active lifestyle. His mindset was still the same and his passions were still the same. Once things were okay from a medical standpoint, Josh himself actually started to look around the community at what opportunities might be out there to stay active and stay fit and to continue to compete.
I knew of rowing living in Boston because I had the Charles, but it wasn't until I was introduced by the adaptive sports program here. My first experience was over in Spaulding, Cambridge, where they have the indoor rowing, but I also wanted to figure out if I could actually go outside and be on the water. So I used the partnership between Spaulding and community rowing and just happened to go one day and did an indoor row with a coach there, and ever since then I've been hooked.
Josh is a really fascinating and in many ways inspiring story of someone who, was active and athletic. They experience a change in life, but at the end of the day you're able to return to sport and being an athlete.
With her being an elite athlete herself, she understands the mind mentality of an elite athlete. She understands to push yourself through some pain, but then the medical side comes in and she understands when the pain becomes something that could injure you further down the road, and she tailors your training to that.
And now Josh has his sights set on the U.S. national team in a sport he has only been participating in for a few years.
I think at the end of the day what I hope for in all of our patients, clients, friends, community members is that people feel like they have the opportunity to set their goals and go for their goals in whatever way they define that. Personally, I'm satisfied when someone is able to say, like, I met my goal.
Everybody, including PTs, OTs, nursing, the environmental staff here, they're all absolutely amazing. They love what they do. They're here to help people in situations like myself or someone that has had an unfortunate accident. And our motto here is find your strength, and I think that's really what they all strive to do for all their patients.
Up next, we'll meet a doctor and a physical therapist who are changing how we approach cycling injuries. The 25 outpatient centers of the Spaulding Rehabilitation Network around New England not only provide the best in sports rehabilitation, but some of the centers specialize in injuries from specific sports, like Spaulding's cycling medicine program in Wellesley. The program is led by Dr. Dana Kotler and physical therapist Greg Robidoux, both competitive cyclists themselves.
The individual that walks in our door, they sit down and we get a great kind of comprehensive understanding of who they are as a cyclist or triathlete. And a lot of that drives what we're going to do with them on the bike.
There's really no program like this that we know of. The fact that you have a full medical evaluation and a full PT evaluation that are happening not only simultaneously and side by side, but really collaboratively with the hope of creating a comprehensive plan, that just doesn't exist elsewhere. I think that's something that we really offer that's really unique.
Dana has a background in dance, but as she pursued her medical career, she became interested in cycling.
I started to ride with people that did some amateur bike racing, and they said, come ride with us, come race. And I said, I'm not fast enough to do that. But it ended up being a really supportive community, especially of women cyclists and women racers. Came back to Massachusetts to do my sports medicine fellowship at Harvard, got involved with the Harvard Cycling Association, and really got to know the cycling community here. I do a mix of road and cyclocross.
Greg was already a physical therapist when he started competitive racing.
I was racing and really enjoying that, and my teammates and then eventually other friends and other people that I didn't know would start approaching me saying, hey, you're a PT, right? And I would say, yeah. And they said, well, I've got this pain or that pain. And eventually I had a cycling medicine practice of my own. And I didn't have enough support to be able to develop it at a level that I wanted to. And I approached Dana and approached Spaulding, and they were 100% on board from day one.
We came up with this idea of a collaborative evaluation where someone's not seeing a doctor who's looking at one set of things, a physical therapist who's looking at one set of things, and then a bike fitter who's looking at one set of things.
On this day, they are seeing a new patient. He is Dmitry Pankratov, a professional cyclist from Uzbekistan. He races for Team Novo Nordisk, a team made up of all type 1 diabetics.
A lot of guys have a lot of aches and pains and they kind of work their way through it. But earlier on this year, he really started to get this disabling back pain. Dana and Greg have been longtime colleagues, and I really respected the work that they were doing, and I understood that this wasn't just something that a regular fitter could be able to do.
If you're trying to change the way the body moves, that's like learning to play a musical instrument. That takes effort, it takes someone teaching you how to do it, and it takes practice. With Dmitry, this is going to be a start of a longer process.
He's been compensating for problems for so long that we're going to have to undo a lot of things that have been going on for a while.
He's going to be somebody that's going to work at a very high level and is very demanding of what we can do for him. But what is really exciting sometimes is dealing with people who are commuters or people that do the PMC. They're the folks that we can educate the most, and that's one of the biggest things that people get out of this clinic.
Alex Carlton has been an athlete her whole life, But 6 years ago, she began to participate in triathlons.
The reason I came to Spaulding and learned about the psychomedicine, I wasn't at the point where I couldn't do my sports, but I was chronically uncomfortable. I was having a lot of discomfort in my hamstring. Where I was sitting, I was really uncomfortable, and then my lower back was hurting, and sort of everything sort of started to fall apart.
We took the full history, both of us looking at different aspects, what kinds of things tend to bring on pain, what kinds of things tend to be better tolerated.
Using ultrasound, she sort of looked at the hip area and my hamstring area where I was experiencing the problems, and she did some tests to test like how strong my left and my right was compared to each other. I was wildly unbalanced. That gave her some indications of areas that maybe Greg would want to look at.
The interesting thing about a bicycle is that you can be positioned horribly, and that may not show up for 2 or 3 seasons of riding. Because it's a no impact and it's a non-weight bearing sport, your body can just take it for quite a long time until it can't anymore. And the hard part for the athlete is that they don't identify that as the root cause. And so if we've got somebody like Alex who's going to go back to competition, we want to accommodate to begin with to allow that person to have the ability to ride their bike with less pain. And then they go through a physical therapy process where we work on their deficits. And then as we get through towards the end of that physical therapy process, we may then make some further adjustments more towards the side of performance for that person.
I needed to put a different insert into my shoe to keep my foot from collapsing, and that actually kind of put my body into the right position. So I felt less discomfort when I would ride from a very quick fix in one area. Some of the muscle imbalances, that took a little bit longer.
Alex also received advice on training and was given techniques that are now part of her daily routine.
There are people who can work with you and they can look at your body and they will get you back on the road and you'll be riding comfortably again. And people are almost amazed, like they've never heard that. I feel amazing. I can go fast and I can get off and run. It's made a huge difference.
When we come back, the Celebrity Spotlight Series travels to Cape Cod to see how Spaulding has been helping aging athletes continue to compete. Ellen Harris is a former collegiate tennis and field hockey player. She later became a runner, competing in marathons. Now retired at age 61, she continues to be just as active.
I moved down here to the Cape full-time 3 years ago and had gotten tired of running, and so I figured it was time to pick up competitive tennis again.
Recently, Ellen incurred an injury around her home.
I got injured picking up a hardened bag of cement as I was clearing the property. I thought I was 21 again. Picked it up, carried it about 10 feet, and dropped it. The next day, I couldn't roll over in bed. I went and saw a chiropractor, and he started treating me, and I played tennis with Sue, and I'm like, you know, this is what he diagnosed, and she's like, I don't know, Ellen.
Her tennis partner, Sue, is actually Dr. Susan Ehrenthal, a physiatrist at Spaulding Rehabilitation Hospital, Cape Cod. Located in Sandwich, the facility has both inpatient and outpatient services.
Physiatrists are physicians who specialize in physical medicine and rehabilitation. We look at the whole body, and not only their body, but what's important to them in their lifestyle. Are they someone who's physically active? Do they exercise regularly? Do they want to get back to playing a recreational sport, a competitive sport? Do they want to just get back to being able to walk longer distances?
Sue is a former collegiate athlete herself.
As an athlete, I think I appreciate more what it takes to be an athlete. I practice what I preach. I recommend to my patients what I know has worked for me, as well as what the latest research suggests. The nice thing about treating athletes is that you know athletes are motivated people. If anything, sometimes you have to tell them to take a break before they return to playing because you have to allow your body time to heal. And I understand as an athlete myself that desire to get back on the playing field, not just for the physical benefits, the weight loss, the cardiovascular training, but also mentally.
We looked at charts, we looked at pictures, and she would show me exactly how I did it and pinpointed the muscles and the nerves. I needed it all explained to me, and Sue was very, very good in doing that. It wasn't when I lifted the bag of cement up, it was when I dropped it. I pinched a nerve and then created a sort of bursitis in the disc. It sort of compounded it. I'm 61 years old and I had never been on crutches before in all my athletic years. So this was a killer.
On the Cape especially, we're dealing with an aging population, so it might be hard to accept that one's not going to heal as quickly as one used to heal.
I used to be able to run out in the court and just do whatever I wanted to do, and right now you have to stretch a little bit more, prep your body a little bit more than you used to.
Ellen's rehabilitation at Spaulding has led to a full return to what she loves.
It's getting better and better every time I see her playing. I never say never. I say, let's try this and see what happens. And if that doesn't work, let's try another approach. Physiatrists are trying to get our patients back to playing their sport. We're not saying, oh, you're too old, you can't do that.
People understanding people. Athletes helping athletes. At Spaulding, regardless of the sport or competitive level, the medical professionals are there to make sure you can continue your athletic passions.
Spaulding is a very unique institution. We have a lot of vision from our chair, Dr. Rossavant, to advance sports medicine, both at the local level as well as at a national and international level. So that's really created the environment where everyone wants to up their game and wants to do the best they can by athletes.
A lot of times in medicine, when something hurts, the doctor says, well, stop doing that thing. Sometimes what we'll say is, if something is hurting you, let's change how you do that activity. Let's make an impact on how you move.
Our team at Spaulding focuses on getting to know the individual. We think about what's important for each person and helping them to get the most out of their rehabilitation.
The basis of what we do is we enable opportunities for people of all abilities to live active lifestyles and to engage in sports and recreation. We also use that as a platform for education. People know us as Spaulding Rehabilitation Hospital. There's a lot more that goes on here.